Hi, this is Dr. Kamran. Thank you very much for giving the opportunity for me to see you as a patient, at least for your consultation. I would very much like to get the opportunity today to tell you what to expect when you come to your office. Obviously you must have had some issues with your legs, and that's why you're here. I just first of all want to let you know that I'm sure on our website, etc., you've seen that there are symptoms and signs related to vein disease, and if you have those symptoms and signs or either one of those, that's why you're here. There's one part you might not be aware is the cosmetic aspect of it. Now, you might not have any symptoms or signs, but you just don't like the way your legs look, and we are trying to add some cosmetic in addition, so that it's just not the veins in your legs. If there are other areas of your leg you don't like, and this involves cosmetics, hopefully with the new staff that have added, we have some very good physician assistants who are trained very well in the art of cosmetics. I believe it's almost 20 years, and we've also got some plastic surgeon advisors who are on board. So I'm very excited going forward, excited for me and excited for my patients that we'll be able to offer cosmetics in addition to treatment of spider veins, etc. Now, what do you expect when you come to our office? The first thing is you will be coming probably through the door, having the same view that you have right now. You will be going to the reception desk. They will talk with you. They tell you what the cost is going to be, what your insurance coverage will pay and not pay. We try to offer a free vein consultation to all our patients. There are some patients which we are not allowed to do free consultation. For example, if you're government employed or you're on Medicare, for example, legally we cannot do a free consultation. But don't worry about that, because our receptionists are very well versed in the knowledge of who should and who shouldn't, so they let you know if there's going to be a charge. Even if you come and see us and you decide that, okay, you want to be a patient, you will be given the opportunity to know that, okay, thank you, Dr. Kamran, but I really want to go and get a second opinion or a third opinion and go somewhere else, then obviously there's no charge. But if you decide at that moment that, look, I'm glad to see you, I want you to be my doctor, I want you to treat me, and then we can tell you what it's going to cost you to your insurance company. So we will do our best to make sure you're well informed before when you come to the office about what it's going to cost or not to cost you. So the way I see my patients is the way I like to be treated, which is first of all, do I have venous disease? Is there anything wrong with my veins? And if it is, are you able to operate on me? Because although you have venous disease, you might have other medical issues which are much more important than your veins, and you probably want to have those treated first before you even have your veins treated. Now, if you say, no, I'm okay, I just want to have my veins treated right now, forget about having arthritis on my hip, or if I need hip surgery or knee surgery, I really want to have the veins treated. The question I would have as a physician, and as most of you may or may not know, in almost a physician almost 40 years, since 1978, and did my residency in general surgery, 2 years in England, 5 years here. I'm not just a technician, so I examine my patients. I want to make sure if my patients can go through the surgery safely, and if they can't, what can I do to make sure that they can go through this operation very safely. So once we see you and examine you, we can tell you otherwise, look, you're just not there. It would be too risky for you to go through any kind of procedure, or we can do some risk modification so you can go through the procedure. So this will all be discussed with you. Now, once that decision is made, then it is a question of finance, right? Does the insurance company pay for your treatment? And there's something I'd always promised myself never to ask a patient is what insurance they have. I felt it was kind of rude. But nowadays, the insurance companies have regulated us to the point that we have to ask certain questions, because it is going to affect your treatment. For example, if you have United Healthcare, you don't have to wear a stocking for 3 months. You can have your procedure done almost immediately, but they want the veins a lot bigger. If you have Blue Cross Blue Shield, you might have to wait 3 months of wearing compression stocking before you have your procedure. So we will be asking about the insurance company. Then we have an insurance clerk who's been with us for very many years, and they're quite aware of what the insurance companies would pay or not pay. Of course, we try to check with them. We try to look at their guidelines online. You're more than welcome to look at the guidelines online before you come and see us. So they will let you know, look, regardless, you need to wait 3 months to have your procedures done, or 6 months, or whatever. They all require stockings, and one of the things I've tried to do is, at least today when you come in, measure you and try to fit you with a stocking, because I've noticed even if a company like United Healthcare does not require stockings, when I do your procedure, you need to wear a stocking. So the day you come for your procedure, if you don't have a stocking to wear, how am I going to send you home? You need to be in some kind of a stocking. So we strongly recommend get your stockings today while you're in the office, so that we can measure you, fit you, and if it doesn't fit, you can bring it back so we can change it or send it back to the company. Of course, you're more than welcome to go online and get your own stockings. Just remember, insurance companies are very particular about making sure that the kind of stocking you get does meet their requirement, which is what I call medical standard stockings. You can't just buy a stocking because it was advertised on television or radio. It's not a medical grade. They want it to be medical grade. They want you to have your bill of sale. They want to have documentation that you got it. So the stocking is obviously important. Please don't leave the office today without having addressed the question of a stocking. After I'm finished with you and you decide that you want to be a patient here, then I do an exam. I write my game plan. I usually do a quick focused ultrasound just to see if you have a disease, how bad it is. If we find you've got arterial disease or other disease, we obviously try to check that as well while you are here. Sometimes I check with your own medical doctor, make sure if they haven't done, we can do it, or if they would allow us to do it. But regardless, if let's say you come and examine you and find out it's not your veins, it is some arteries in your leg which are blocked, or you've got carotid disease, then we recommend that you have those checked before you even have the veins treated, because that's obviously much more important. Arterial disease is much more important than vein disease. So having done all that, then we bring it to the insurance clerk. Usually one of my surgical techs is with me, or a nurse, and they come in to the front desk. They'll introduce you again to our receptionist, who are very well knowledge in how we do these things. Most of them have been with me for a long time. We really have been doing it for almost 18 years. It started in 2002. A lot of my staff have been around pretty much since then, or have been trained by somebody who was there with me since then. So they will tell you what it's going to take. They schedule your ultrasound on your leg. So why do you need an ultrasound? Because a proper ultrasound is to do up both legs. It takes about an hour and a half, and obviously we don't have that kind of time to walk in and just give you an hour and a half. Our ultrasound techs are usually busy, so we like to schedule those. We also, you will be probably on your feet for about an hour and a half, so people get lightheaded. We want you to have a big breakfast, big lunch, drink plenty of fluids, so you're not tired and don't get lightheaded when you're standing for a long period of time. So your mapping, your ultrasound will be scheduled at your convenience, and then after that is done, we can certainly, let's say you have Blue Cross Blue Shield and you have to see us every month. With the telemedicine now, we try to do the second visit or probably even the third visit that way, because they want, first of all, it has to be HIPAA regulated, so telemedicine is important. We can't just do a Facebook. It has to be done by certain companies which guarantee your make sure that you don't get exposure of your name, etc. So it's HIPAA regulated, and then we document, that you have worn the stocking, done all the exercise, etc. So it saves you a few extra trips to the office. The third visit, which is usually when we write a letter to insurance companies, we really want you to be in the office, so we can talk with you and and make sure do another ultrasound, focus ultrasound. There's no charge to you. I just do a quick one just to make sure there's nothing new developed. Again, answer some more questions. By the way, we have a podcast. It's called Nice Living with Dr. Kamran. That podcast is very important. Please listen to it. The recent ones that I've done in 2020, there are about 4 sections, just nothing on veins. So by listening to that, hopefully a lot of questions that you might not even know you had, it will be answered by just listening to those podcasts. I've got there's a lot of stuff on YouTube, on online. If you just look at the Dr. Kamran or Scarless Vein Care, you should be able to see that. Now, there are quite a few people there who try to either imitate our name or send you to another website. I honestly see that as an honor. I'm glad that we are so good that people are trying to imitate our name or my name or Scarless and try to turn it into something else. The only request I have, please make sure that it is Dr. Kamran, it is Scarless Vein Care, because I take tremendous pride in what I do. I pretty much guarantee you that to the best of my knowledge, I'm using the best quality of laser, best quality of everything that I can find for my patients. We still get paid the same. We don't get paid anymore just because we use better quality or worse quality. In fact, it would be tremendous saving if you use something cheaper. But cheap is not what I stand for, and I've been doing this for very many years, probably 70, 80,000 patients over very, very many years. And to me, you always give people the best quality you can afford to do. And so that's why it's extremely important when you look at other websites, please remember, they don't necessarily do things the way I do it. And my recommendation is if you have any questions or any doubts or you're worried if the procedure is painful or not, talk to one of my patients, somebody that I have operated on, that they've had experience in my office, see how their experience was. Again, it honestly and truly is an honor to have you decide to come and see us and see me and allow me to be your doctor, allow me to be your surgeon. I really feel that is an honor, and I like to appreciate and thank you in advance for having the trust in me and in my staff. Thank you.